All right, so here I am with my C or D patient requirement. So I'm gonna start off by probing. And again, I'm gonna make sure that I'm practicing my proper ergonomics, and I'm gonna be doing the surfaces towards me again. So I'm gonna be sitting at the 9 o'clock position. And then I'm just gonna make sure my patient turns his or her head as I need them to, so enable for me to see. So I'm just gonna go ahead and get my probe ready. So what I wanna do with the probe is just go gently in the sulcus and just kind of let it bounce back at me when I touch the sulcus. I want to make sure that I adapt the tip to the long axis of the tooth, make sure the tip is constantly on the tooth. So I'm going to start off going at the distal right here, and again I have my fulcrum finger is on the occlusal surface, and I'm just going to go ahead and just use this motion and then go down, come back up, and just let it bounce back towards me. And then go down, and then come back up. Okay, and then I'm gonna go in with my Explorer. And again, just check to make sure that I have the proper working end. So this looks right to me. And then this, of course, is not correct. So I'm gonna go in on that same tooth. I'm just gonna go and make sure that I'm using the rocking motion and rolling, rolling, rolling. Get under the contact, stop, and come back. And just make sure that that tip third is constantly on the tooth. And roll, 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 and then come out. Okay, so for the C or D patient, I usually like to use the standard and the slimline ultrasonic tips. We would never use the ultrasonic on a child. So I'm just gonna go ahead and go in with my standard. So one important thing with the ultrasonic tip is to never touch the tooth directly with the tip. Always keep the tip in constant motion, because otherwise you're gonna do some damage. So I just want to make sure that the lateral side of the ultrasonic is always adapted to the tube surface. And so here, I'm gonna start with my slimline. So the slimline is pretty good for deplaquing and smaller deposits. So what I like to do is I usually just like to go in and I always have the vacuum or the suction. I usually use that for retraction. And I just kind of use the sweeping motion for deplaquing and just kind of, get in there. I'm just always moving it. Sometimes I use that. Okay. And then the standard, I usually tap the I'll go in and tap. If I feel a deposit, I'll tap it and just knock it away. I'll do sweeping motions too. Okay. So after that, after I'm done using the ultrasonic tips, I'll usually, go back with my Explorer and feel if I missed anything. So let me see. I'm gonna go in. Let's say I go back and I feel something. Let's say I feel something on the distal of a posterior tooth. I'm gonna pick up my 1314 curette. Okay, and then I'm just gonna make sure, so I have the cutting edge. Well, I look, and this looks like the right end, and I check, and there's the cutting edge. So the 1314, all you do is so I'm gonna position my fulcrum and go at the very, the distal right here, the distal line angle, and just real quick, it's just a quick motion, just the rolling right in the distal and getting that. Okay, and then let's say I want to pick up my 1112. So, yep, here's the cutting edge. I'm going to start the distal and that rocking motion. Oh, there's some makeshift calculus in here, I just felt. Okay. trying to position my phone correctly. Okay. So then let's say my posterior sickle. This is for the supracalculus. The curettes are usually for subgingival calculus. So here's my posterior sickle. I'm just gonna, again, and go. Okay. All right, and then let me show my anterior curette, if I can find it. Let's see. No, that's not it. Okay, here it is. All right, so let me do the lower anterior teeth right here. I'm gonna do the surfaces towards me. So here's my my anterior curette. So I'm just looking at it and trying to figure out which side I need. Okay, so I'm gonna do this side because here's the cutting edge. So what I want to do is I'm gonna start the midline and just under the gum tissue. Okay. And then I'm gonna pick up my anterior sickle, wherever that may be. And the same thing, just right at the midline. Make sure the tip third, stay above. And there we have it.